Hey guys, this is Brad Hightower, and welcome to episode 4 of the Note to File podcast, interviews, best practices, and ramblings for clinical research sites. So I do want to take a moment and thank everyone who's listening as I sort of polish the format for this podcast. Right now you're hearing a bunch of monologues basically, although I do have my first 3 interviews scheduled, so keep an eye open for those. If you're interested in being interviewed for the podcast, you can reach me at brad@notetofilepodcast.com. So today I want to talk a little bit about clinicaltrials.gov. If you're in clinical research, you've obviously used clinicaltrials.gov. A lot of people sort of cite that as a source for additional business development, as they should. Everybody should be using clinicaltrials.gov to help source new trials that are coming in. But I kind of want to dive down a little bit deeper into that and also share one process that's helped me tremendously, which is just creating an RSS feed from a clinicaltrials.gov search. That way, the info comes to you. You're not having to go troll the clinicaltrials.gov website every day. So you can instead read about new study opportunities in your favorite RSS reader or have them sent straight into Outlook. So the first thing I want to say is that if you use clinicaltrials.gov as a source of business development, you probably know that you are going to receive a lot of non-responses and also a lot of no's. So the first thing is, don't let that discourage you. Oftentimes, even if a study is no longer enrolling, if you have a good contact, they may be able to take your information and possibly be considered down the road for new trials for that sponsor. So stick with it. It is a rather tedious and can be a frustrating process. So don't be discouraged if you don't get a lot of positive responses. I would guess that it's maybe a 20% response rate and then maybe a 5 to 10 positive response rate. And that might be generous, just depending on your situation. So next I want to talk a little bit about search criteria. So if you use the advanced search and are very specific in your search terms, you just have a lot better opportunity of finding studies that are going to be appropriate for you and your site. So click that advanced search button. I always recommend that you use that. You can begin by putting in a condition or disease. If you're a single therapeutic site, it might make sense for you to enter real specific search criteria. I work across a lot of different indications, so I like to leave mine blank, and that way I can really see things across every possible therapeutic area. If you have that flexibility, then obviously that will open you up to a lot more opportunities. But from there, the status of the study, obviously I like to just click the recruiting and not yet recruiting options. Oftentimes recruiting studies will still be open to adding sites. They may even be several years in and decide they need to add rescue sites. So those studies are still on the table at that point. And then really from there, it's up to you. You can search by age. You may not want to select, the child population if you're not seeing pediatrics. You can, get deeper into if you just want interventional trials versus observational. I tend to be pretty liberal with these things. I tend to leave them open. You can choose the phase. If you don't do phase 1 trials, don't check phase 1. Again, it's just going to save you some time digging through these potential leads. You can also start from when it was first posted or when the study first started. So that way you may be able to get the most sort of fresh leads as they come along. Again, I actually leave those open and I go ahead and hit search. And then let's talk a little bit about results and sort of maybe some simple ways you can sort of vet these studies, again, to save yourself the trouble of sending an email to a contact that's just not going to end up being a good result for you. So one of the first things I look at, aside from the indication, obviously, is going to be the estimated enrollment. Obviously, the bigger the number is, the more likely it is I'm going to reach out. If I notice that the study is only enrolling 15 patients, then it's very unlikely that this is a multi-center trial. Again, you can save yourself some of the time and trouble of reaching out to someone who's going to say no. I also like to look at the actual study start date and the estimated completion date. So often people are not updating these things, so you can kind of look at this one of two ways. If the study completion date is very soon or even in the past, it's possible that the study's still going and they may be looking for more sites. If the completion date was long in the past, it's very possible that just nobody went and updated this listing. You can actually view the history. If you want to go, again, a little bit deeper, you can check the history of the posting, and that's actually going to be listed at the bottom, down towards when it was it'll say when it was first posted, but right above that it'll say there's a history of changes. So if you want to go really down the rabbit hole, you can see how often this listing was updated. Again, you may not want to spend that much time on each particular lead. I also like to check the locations and obviously, most importantly, the contacts. So again, if I see, one location in Japan or Sweden, it's probably unlikely this is a multi-center trial that's even taking place in the United States. So again, you may not want to go down that rabbit hole. And also check the contact information. That's obviously going to be what we're really here for. I often find if it's a specific person, I have a lot better result than some of the listings that list a sort of generic contact. Some of the larger companies tend to do that. I've really never had any luck. So, these are like the Pfizers and Johnson & Johnsons. If you've got contacts within those companies, reach out to them. The sort of generic contact information from these large companies generally is not of use for us. So from there, I generally like to send an email as my first point of contact, and it doesn't have to be anything ridiculously over the top. Sometimes it's as simple as saying, is this study still enrolling sites? I work with an investigator who's very interested and has a lot of experience in this field. Can you please tell me more? Something along those lines. Obviously, you may want to sell yourself a little bit, but also you don't want to waste too much time on the front end. I'd certainly recommend keeping a template in Word somewhere where you can copy and paste. Make sure you address the person by name. Make sure you pay attention to that and don't send the wrong name. I've certainly done that before when I've been a little bit more on the lazy side, but these things happen. And then after that, follow up. I generally follow up about once a week. Truthfully, after between 5 and 7 tries, I'll usually stop at that point and call it a dead lead. Again, you don't want to be wasting all of your time going back to the same well over and over again if it's not producing anything. So something that really helped me spend a lot less time digging through leads on clinicaltrials.gov is setting up an RSS feed. So essentially what you want to do is go through the advanced search and set the parameters exactly how you'd want to see them as you search through clinicaltrials.gov. Once you finish your search, up right above the search results, you're going to see subscribe to RSS. From there, you are able to, it'll generate a URL that you're able to enter into on our RSS reader, or you can even put it into Outlook. I know a lot of large institutions use Outlook, so that might be useful for you. Instructions on how to do this are at my website at notetofileapodcast.com. Just check the blog post for this episode 4. And I've included some screenshots to make it real easy for you. I will say, though, again, this sort of brings the studies to you. You don't have to go to the website every day, create a new search, or bookmark a search and refresh it every day. Instead, you'll get real-time updates as new studies are posted. That, again, makes your job a whole lot easier. You're going to see the studies right as they hit clinicaltrials.gov. I use Feedly as a reader for all my news, and I just threw that RSS feed in there, so I'm able to see them, again, as they come up, and kind of helps me stay on top of new studies that are appropriate for me. So that's really it for today. I just wanted to give some sort of judicious tips for using clinicaltrials.gov. I know that when I first started using it, I spent a lot of time digging through all types of studies and sending emails to contacts that were clearly not appropriate studies for me. As I instituted the use of RSS, I spend less and less time there. And again, the studies are still coming straight into my newsreader. I'm curious to hear what you guys do. Do you guys have some more sophisticated means by which to use clinicaltrials.gov? This is surely not the most high-tech way to do things, but it works very well for me. So thank you guys for listening. Make sure to rate, review, and subscribe. You can check us out at notetofileapodcast.com. Thank you very much.